Let's call her Ada. I remember one lady, she reached out to me very frustrated. Nrsvee, I have treated yeast infection for like 5 times this year and it looks like nothing is changing. She told me that every time she notices whitish discharge, burning sensation, all of those symptoms of yeast infection, she runs to the chemist shop. I think those guys are the richest people in the drug market because they live closest to the women in the community. And every time, every woman, most women, let me not say every woman, most women, once they just notice any of these signs, even normal vaginal discharges, they think something is off and they quickly run and go and get infection drugs. So this lady, let's call her Ada, she reached out to our team, helped out with Nrsvee. I'm frustrated. I keep treating this thing. It keeps coming back, and in fact I think it is the drugs that are not working, so maybe let me try another route. You know what she did? She started avoiding sugar, all of those carbonated drinks. She said they said it is sugar that builds yeast, so she avoided sugar. She changed all of her underwears. She did virtually everything she thought was right to stop this yeast infection from reoccurring. Then she said, Nrsvee, I tried everything, yet this thing just wouldn't. Honestly, many women are like Ada, but once you just notice itching, the small burning sensation, your mind quickly runs yeast infection and you go to the nearest chemist shop to get in. Here is where it gets interesting. Ada told me that she noticed that once it is getting to the time when her period is going to come, it looks like these symptoms increase, and then when her period has come and gone, the symptoms seem to die down a bit and then return again when her period is about to start. And that told me that at this point she got tired of trying home remedies and over-the-counter medication, so she quickly ran to the clinic and then she was asked to run some investigations. She told me that when she came out, surprisingly, they said she did not have yeast infection. That said, Nrsvee, at this point, please, you are my last savior. What exactly is wrong with me? Now, like many women who are on this particular table, what Ada had was what we call Cytolytic Vaginosis. That's what it means. And in our vagina, we have what we call the good bacteria that helps to protect that vagina area. It is called lactobacillus. So this bacteria is a good bacteria that helps to safeguard that vagina area. So what happened to Ada in this condition called cytolytic vaginosis was that she had too much of this good bacteria. Her vagina, every woman's vagina is acidic, right? But her vagina was too acidic. That good bacteria was now causing that irritation. Imagine that you are treating an infection and you don't even have it. It was just because this lady had what we call cytolytic vaginosis. Now this is where I need you to pay attention. Not everything happening down there is an infection. So I know that the question that is actually burning in your heart right now is, Nrsvee, what do we do? Right now, sit down. The first thing to do is to calm down. Relax. It's not everything that you panic and get very worried about. Secondly, please stop abusing over-the-counter medications, right? Once you notice something is off there, please, you can speak to Nrsvee. Or you can speak to a trusted medical professional. Don't just assume. Assumption is what gets a lot of women on that problem level, right? Get professional help. Visit the clinic where proper investigations will be done so that we can actually ascertain what exactly is wrong with you. So stop assuming, because like in cytolytic vaginosis, the treatment for this is totally different. It's not about killing any infection. It is rather about restoring balance. Now, what do you think you're doing to yourself when, one, you're even abusing antibiotics, which you shouldn't in the first place, and you keep trying to kill something that is not there? So please, if you're on this table, run to the clinic and get yourself. So I advised Ada to quickly go to the hospital. Now, when Ada went to the hospital, the doctors asked her a series of questions and she answered them. Secondly, they asked her to run an investigation. They checked the vaginal pH, yes, the acidity, level of acidity of her vagina. They asked her to do what we call vaginal swab, which is an investigation to know exactly what is happening down there. So you see, when she had finished all of that, the doctors told her that it was cytolytic vaginosis, and it wasn't about killing any infection. It was rather about restoring balance. Now, if you have been having these recurrent yeast infections, please don't assume. Ask Nrsvee. Ask Nrsvee, or visit the nearest healthcare center closest to you and get proper help. Stop bombarding your system with a lot of antibiotics or trying to kill an infection that you do not have. I know, right? You are welcome. If this video helped you, please like, comment. This will actually help the algorithm reach out to many more women. And don't forget to subscribe to our YouTube channel for more insightful women conversations. And you are not stingy, right? Share this video to every woman in your life that you know have been struggling to kill yeast infection that they do not have. See you in our next video.